Hello, and welcome back to Dietitians Beyond Borders. I'm your host, Jennifer Chaloub, and I'm so excited to continue our global journey exploring how nutrition and dietetics are practiced around the world. Today, we're heading to Greece, a country with a rich history of food, culture, and health. Joining me today is Antonis, a registered dietitian from Greece, who will share insights into the profession, the Mediterranean diet, and how nutrition is integrated into Greek healthcare and daily life. Welcome. Hi. It's such a
Hi,
pleasure.
Jennifer.
Hey, it's such a pleasure to have you on the podcast. Let's start with you telling us a bit about your background. How did you become a dietitian and what inspired you to pursue this field?
So, so I became a dietitian a few years back. I think it's more than 15 years now. I was always interested in health sciences, and I think dietetic had a special charm to it. It wasn't a very prominent job or career in Greece, but that made it a bit more interesting. And I think ever since I went in the university the first few years, I was really inspired by the research that it's carried out on dietetic research and nutrition. And it made me a bit curious to see how this field will progress. It felt a lot like it had a lot of unanswered questions. So that inspired me a lot. So yeah, that was pretty much the story of how and why I became a dietitian and why I stayed in the profession. I have worked in various places after that, and mostly research roles, but applied research. So I studied in Greece, my undergraduate, and then I went to Glasgow to do my master's and my PhD in human nutrition. Um, and then I worked a bit more on obesity, weight management, and the nutritional biochemistry side of those things, working on markers of disease and how we could predict earlier chronic diseases with an eye on the earlier I can detect something, the more impactful a dietetic intervention will be. Because, in my eyes, there's this gray area of when you are medium, low risk, so you're not falling into the high risk situation, so maybe medium risk. A lot of people feel that going into dietetic intervention and nutrition intervention, we can call it either way at that stage, um, it doesn't have a benefit. So having an actual marker that you can track and something that you can link to risk further down is important. And from there, I left and I went to a private research center, the Nestle Research Center in Switzerland. And there my career took a small detour, which I've kept until today. And I'm working more on policies that improve the foodscape, so the food environment around us, to actually help nutrition being the easiest choice. So that's pretty much about me. And I'm back in Greece now for the past 7, 8 years now. And I work in the Agricultural University of Athens. I'm an expert in obesity with the European Federation of the Association of Dietitians. And I do various other things as a consultant.
This
And
is
I'm the vice president of the Hellenic Dietetic Association. That's, I shouldn't forget that. Yeah.
which is very important, very important to say. I actually, just for the audience to know, I actually, met a doctor, right, Dr. Antonis in through this association. So shout out to them. They phenomenal, and just listening to you and listening to how you became a dietitian, and that growth and you getting out of your comfort zone on so many levels. Not a lot of people do that. Not a lot of people do that. So it's so fascinating, and thank you again for being here. We're so excited, all of us, to learn more about a lot of how food is embedded, in food and nutrition in Greece, and especially how like Mediterranean diet. I'm not sure if you're aware, but I live right now in the US. I'm Lebanese, but I live in the US at this time, and the Mediterranean diet is the hype. So we'll talk about it in a couple minutes, but just wanted to let you know that. So let's talk about education for a bit. What does it take to become a dietitian in Greece? What are some requirements for formal education and credentialing?
So, dietetics is a pretty protected environment in Greece, like in most countries. So, you have to have studied in one of the five accredited universities that we have here in Greece to become a registered dietitian. It has to be your undergraduate degree, so you cannot take an RD by doing a master's from another degree. So you have to have an undergraduate degree in dietetics. And of course, there are ways that people can transfer their RD from other countries to Greece, but it's mainly from EU universities. So if you are a registered dietitian in other countries other than the EU, the situation here is a bit complicated. And the main reason for that is although we are recognized as we have registration is through the central government, so there is no uh, formal body yet. We are in the process of creating one. So we're hoping that 2025 will be the year that we'll have a legal entity that will oversee all the RDs, and there it will be easier to actually transfer your RD from third countries outside of EU to Greece. Typically here in Greece, though, a dietitian will have to do very similar courses to what you do abroad. So it's a 4-year course, and it has a research element to it and a practical element. So you have to do at least 6 months of placement to actually fulfill your degree. And you also have to have a research element. So we do a research a dissertation at at the end of the 4 years, and that will kind of conclude the totality of the teaching to become a dietitian. But other than that, courses wise, you do clinical nutrition, public health nutrition, you do enteral and parenteral nutrition. You also do a few courses on food science and food production. And you have to learn the hazard analysis of critical control points because dietitians in Greece are in charge of the whole kitchen and the food structure within the clinic. So you have to be able to manage non-medical personnel and to also manage the production of the food within. Um, and we also do a bit of HR and finances, again, because it's more towards the career of me managing a department that actually will have to do procurements for the totality of a hospital and also checking all this. So that's the basics of how you become a dietitian in Greece.
Do you guys do internships during those 4 years or after the 4 years? There's like an internship or like a clinical rotations and food service rotations. You know what I mean? Like putting
We
kind
do their placements. The placements happen during the 4th year. So the 4th year, you have a bit of classes. I think it's two, in most universities, 2 classes per semester. And at that time, you are expected to do your clinical rotation and also to run your research project. So
of
that happens in the last two semesters of a 4 year degree.
okay. And then do you have an exam to complete
No, 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 no.
to automatically become a dietitian once you graduated?
From these five universities, yes.
Okay. 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 I love it. I love it. I'm meeting other guest speakers as well. And it's so fascinating how every single country, although, dietitians, we're doing like a lot of similar work, right? But the requirements like just change, a bit
Yeah.
throughout, but it's very interesting. How is the role of dietitians recognized within Greece's healthcare system? Are dietitians integrated into clinical settings and public health? And also, I'm asking, dietitians from all over the world, are they also being valued? Are they getting the recognition that they need or they deserve?
So that's a tricky question. So in the clinical setting within hospitals, yeah, I mean, we are part of the organigram of every hospital. The law exists that says that we have a specific number of dietitians required per patients treated, which is an okay number on paper. In reality, well, Greek healthcare is generally a bit understaffed, and of course, dietitians also are not seen as a priority. So there is a priority on medical staff and nurses, and we have quite a few hospitals that you wouldn't find a single dietitian in, or big hospitals in Athens that you will have two or three dietitians for a fairly large hospital. So that's what I'm saying. It's a tricky question to answer. I think there is recognition, and the recognition is growing. I think we're still undervalued in the sense that we're seeing a bit more for the majority of clinical conditions. We're seen as an auxiliary personnel and not a core personnel. There is a big need to also educate policymakers and medical doctors on the importance of undernutrition in critical care and undernutrition screening the minute you enter for any disease a hospital. Now, if we talk about public health, there I think things are pretty ugly in Greece. I think we have less than 10 primary care dietitians in Greece. So it's not a very well-known role at all. Um, and I'm talking about formal environments, okay? I'm not talking about private practice. Private practice is
Yep.
the main employment for dietitians in Greece. In that level, I think a lot of people will come to us and they would fall in the scope of public health. A lot of dietitians are consultants. They will go to schools to give lectures, but you wouldn't find a dietitian in schools. You wouldn't find a dietitian in any public health type of environment, with potentially the exemption of the odd dietitian in private rehabilitation facilities. But again, I wouldn't call that public health. Their main role there is rather to support the more clinical cases rather than just to guide everything. So we have a few dietitians in Greece working in the food industry, which I guess would fall under public health. And we have a growing amount of dietitian working in sports, nutrition, and dietetics, which would also fall less into clinical and more into public health. But no, I don't. I think we have a very long way to establish our role in the various settings that we have, and also uh, for policymakers and the society to recognize the value of a resource like a dietitian on these places. So, um, being in charge of school canteens and educating children. There are reasons behind that. So, for example, for your audience to know, so Greece is the case of these countries when school finishes early. So we finish at around, well, latest 1:30. So we don't have we don't get lunch served in schools. There is no formal feeding provided in the school setting, with the exception of very, very small children. And so, as you can imagine, there is no direct need for a dietitian to take care of the provision of those things. And I think that's one of the reasons where the issue of us being excluded from primary care public health starts. Very few facilities would offer food if it's not in a clinical setting, and hence it's difficult for someone to imagine a role of a dietitian there.
Yeah, yeah. And you know what? It will get better. It will get better. I feel we're in a time, nutrition is being more recognized, not just as, weight management or aesthetic, right? But also, as you mentioned, it is the prevention of bigger diseases. If somebody can catch it earlier, somebody can get the proper intervention from a dietitian earlier, whether on an individual level or a community level, it changes a lot. But step by step, step by step. And you guys
Yeah.
are working on it, right? You're doing everything you can to kind of get this level a bit up, get it more recognized, and you're doing God's work, which is amazing. Um, Greece is known for the Mediterranean diet, right? We were just talking about it. It has been associated with numerous health benefits. A lot of research about the Mediterranean diet, how much it's helping through a lot of things. How is this Greece's nutrition practice? And do you find that people in Greece, do they still follow like traditional eating patterns, or they're just going on, with more westernized eating trends? That's a big question, sorry.
Okay. Yeah. So I am, well, I think Greece for many years now has been experiencing the nutrition transition. I mean, the Mediterranean diet, as studied by Ansel Keys, it's just post World War II, so it's something that it's very current, but the actual paradigm is quite historical. For sure, we follow a lot of the practices. Now, I personally teach and study the Mediterranean diet, and you can understand that there are two things in the Mediterranean diet. So those are the concepts of frugality and also the concept of celebration. So we have a lot of food that is designed for celebration, and they are more indulgent foods and at larger proportions. And then you have the whole frugality concept. So as you can imagine, it's easier to keep and follow the celebratory part. It falls a bit more closer to the current eating needs. So although we do see a westernization, it would still somehow follow the Mediterranean diet in the sense that the food choices will still be there. Definitely the adherence to the frugality concept is low. Overall, the statistics show that Greece has dropped in adherence to the Mediterranean diet, but we're not very low. We do keep quite a few elements of the Mediterranean diet. So the use of olive oil is out of question. I think we only had issues with the use of olive oil at times of recession, where this actually became a real problem. Our dairy intake is also good. Then we do struggle a bit with fish intake. And then all the legumes, lentils, and things like that are a bit tough. So we do follow some parts. So we reach our fruit intake more or less on average. But we have issues definitely with red meat consumption and the consumption of the less energy dense plant-based protein sources. I would say the biggest shift that we see is the shift towards animal-based diets more. So we're losing this element of plant-based. But I think what's important to understand is that a lot of people who don't come from the Mediterranean, they hear about the Mediterranean diet and it's a conscious choice. So in Greece and the majority of Mediterranean, it wasn't necessarily a conscious choice. It was a choice that was sustainable in the sense that they had to follow the dietary pattern to survive and thrive in the conditions. So after World War II, with economic growth, this concept of frugality for the people, the gatekeepers of the Mediterranean diet, was seen as something oppressive and something of the past and something that they need to change. And we do have evidence that even back then, when Mediterranean diet adherence was very high, in the higher socioeconomic classes, Mediterranean diet adherence was quite low. So there was always this battle of trying to live, a larger life, which actually meant that I wouldn't have to follow this diet. And we're now re-educating ourselves to go back to the Mediterranean diet, but more consciously towards it, and not because there is a recession, not because there is less access to things, but more of an educated nutrition transition. It's been a struggle. And we are seeing the same things as you would see in the rest of the world. So you would see the higher socioeconomic classes now following the Mediterranean diet because they are a bit more aware about nutrition education. And you would see the lowest adherence, not in the very low socioeconomic class yet, but I mean, I think the mid-low socioeconomic classes would have the lowest adherence. But that, again, it's both a social matter, an educational matter, and it's also a matter of marketing in terms of appearances and status. And, we still in the lower socioeconomic classes, if you're seeing into lentils and chickpeas, it would still be considered as an enforced choice. You couldn't afford something else, and they would still avoid it when they could.
Wow. This is amazing. Those definitely listening from the US. I mean, here this is it, like the plant forward Mediterranean diet is kind of the diet to go at this time. Of course, as we know, nutrition is such a young science. Tomorrow god knows what we'll have, right? But for now, this has been shown like the most sustainable, most realistic, and definitely proving a lot of health benefits. But it's so interesting, and as somebody coming from a place where also Mediterranean diet has been embedded in like our blood, right? Since like the first day we're born, it's like part of who we are, right? Whether we're eating a bit of cheese, whether we're eating a bit of nuts, seeds, olive oil, as you mentioned, those like kind of staples that maybe some people from other countries won't know, like, this routine, it's like embedded in us. But it's so fascinating how there's that journey, right? And that it really depends on what what
And I think that's the challenge for dietitians here in Greece. I think we also have to understand and to adjust our practices in the sense that because it's something very culturally embedded, I'm not sure that stating the facts, so the sustainability benefits and the health benefits is the main driver. It's more cognitive behavioral therapy and trying to bring people back to those familiar patterns. So use that emotional element of the Mediterranean diet for them to understand that, it's not restrictive, it's going closer to your roots. Making sure that you do not lose the recipes, you don't lose the eating patterns, making sure that you recreate moments. And the further away we go from the generation that really follow the Mediterranean diet, it's also, paying an homage to people that, your children may not have met, but you have met as grandparents, and you have good memories and you would like to relive those memories. And I think in Greece, and I guess in many other countries, the Mediterranean, this emotional element is a big driver that we can use to increase adherence, but it's also something that means that we need, as dietitians, to act and consult differently. It's not a piece of paper, it's not a target of how much fish you're eating per week. It's really revisiting cultural habits that they are stored somewhere in the back of your memory, and you need to relive them and make them part of your everyday life.
100%. 100%. I love that. What are some common nutrition related health concerns in Greece today? How do dietitians approach issues like obesity or diabetes or cardiovascular disease?
So I think we don't, in that element, we are the same as the majority of Europe. So yes, it's obesity, it's diabetes, it's hypertension, and we also see a lot of gastrointestinal elements, especially those linked to obesity. so non-alcoholic fatty liver disease. We do see increasingly more in private practice, kidney diseases also. They are becoming a bit more common. Um, okay. The reality is that for the majority of chronic diseases, it's true, the low-hanging fruit is Mediterranean diet. It's been proven to have benefits there. It's easier to adhere. So that will be our go-to place. Low-fat diets or other diets that may be popular in the US do not, they feel very strange and very difficult to follow. They're also not very sustainable, not in on the element of the environmental sustainability, but how far the eating habit changes are from where you start. So the Mediterranean diet is our go-to for those for the majority of the chronic disease that you would see. Other than that, I don't think we see anything in particular that it's different to other countries. We do get a bit of undernutrition. I think it's two things. It's becoming a bit more aware. So there is better screening for undernutrition, especially in older adults. And so you do get a bit more of this. And I think there's also higher sensitivity in terms of the public on self also diagnosing disordered eating. So we do have more and more people coming to a dietitian to discuss their relationship with food or concerns about potential eating disorders or the development of such things, especially in females in younger age. And of course, uh, losing weight, gaining weight. It's also very common, and I would be lying if I said that. I think in the male population, it must be kind of 50-50. So you either get them later on at life where they would come for obesity and hypertension, and if you get them earlier on, it would be a lot of I want to build more muscle, I want to look more muscular, I want to gain weight. You have a lot of this element of sports type nutrition that we see on a daily basis.
Very nice. Very nice. Oh, that's great. So I know we spoke about a couple challenges the dietitians, maybe have faced indirectly, right? What opportunities for those dietitians, especially given, the growing awareness of nutrition? What opportunities do you feel like they're emerging, like hopefully within the next couple of years?
Well, I think the challenges are more systemic. The profession itself is in a growth pattern. So we see a lot of private practices and they're all quite well attended. So I think there is a great opportunity there. I think the public is clearly recognizing the need of dietitians, and we do get slowly to become part of their go-to primary healthcare professional. So I think it's pretty uncommon to meet someone who has never been to a dietitian, has never talked to one, for various reasons, which I think it's a great opportunity. Also, in Greece, at this stage, we have a nationwide program for childhood obesity, and that nationwide program is engaging with dietitians in every country and in every city in Greece and in every town. So I think that's also a big push for recognition and also to remove the stigma that there might be in some pockets of the population on going to a dietitian. So I think those two are definitely big opportunities. And
Great.
I also think that, having our own legal entity to register, to control registrations and to promote the profession of dietitians is going to be a huge step towards improving the situation of dietetics.
Absolutely. Absolutely. Looking forward to all of this. And I hope, obviously we're gonna stay in touch. And I can't wait to see this field of dietetics in Greece just blossom and keep on growing and growing. So before we wrap up, what is one piece of advice you would give to aspiring dietitians or anyone interested in pursuing nutrition, whether in Greece or anywhere in the world?
So I think I'm going to be a bit biased on this. I but I'm gonna say it anyway. I feel that in the heads of most people, nutrition or dietetics is pretty much a one-way street, a single direction career-wise. And I don't think it's like that at all. I think the biggest opportunities come from us infiltrating, if you want, neighboring careers and neighboring professions and working environments. And I think for anyone who wants to work in dietetics or nutrition or is already working and they're trying to find their footing in this is try different things and think outside of the box. I think there are a lot of new careers that are coming up and we might have them under the radar. We have a lot of conferences that are organized nutrition and dietetics, so we might need people to actually help organize educational activities that could be your full-time job. There's a lot of communication going out, so having people who have knowledge of the subject matter, but also skills in communication is important. A lot of new projects coming. So I talk about the National Obesity, Childhood Obesity Management and Prevention Plan. I mean, we have a lot of dietitians that work there as project managers. They might not actually see patients, but they need someone who knows what a dietetic intervention is to design one in such a large scale. So I would definitely say think outside the box, identify what are your interests and what are your skills, and try to envisage your career. And the good thing about those young sciences is that is a lot of room to carve out your own career path and show the road for many more to follow. And I think that would be my main advice is do not fit this. If you don't fit in the box, doesn't mean that this career is not for you. Maybe there is a slightly different box adjacent to that one that you could carve out for yourself.
Incredible, incredible. And you are living proof of it, right? Whether you or a lot of, inspiring, incredible dietitians. Thank you so much for joining me today and sharing your expertise on dietetics in Greece. It's been so wonderful to hear about the Mediterranean diet, nutrition trends in your country, and the work dietitians are doing to improve all of it, right? Whether clinical, public health, you name it. To our listeners, if you enjoyed this episode, be sure to subscribe, leave a review, and share it with anyone who might find it helpful. You can also follow me on social media. You'll see the caption below, or for more updates and future episodes. Until next time, stay curious, stay nourished, and keep exploring nutrition beyond borders. Thank you.